Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside some of the best plastic surgeons in the country. Now I don't work for anybody, so I have unbiased opinions about hundreds of surgeons from across the world, and I can help you achieve the body of your dreams. Hey guys, do I have the show for you today? I've been getting myself into lots of things that I haven't really disclosed on the show. And one of those things is I have been helping other people in the community expand their voices. And one of those people is Tonya Spanglo. The other person is Teresa Parent. And you guys might remember Teresa from our episode where she told us about her transformation journey from being 600 pounds and losing how many?
I've lost 460 pounds now.
460 pounds, and how an amazing transformation that has been. And today I'm so excited because I have them both on, and we are going to go into all of the details, all of their questions of having surgery, plastic surgery after weight loss. You guys, thank you so much for being on the show with me.
Thank you for having us.
I'm super
We're
excited.
So the plan for the episode, I know my audience really loves whenever I go into the details of the questions that they might have, but they might be too shy to ask. They might be too shy to ask their surgeon. So I love these episodes where I really answer as many questions for you as I can. So let me first introduce Tonya and let her tell you a little bit about her story and what's to come for her in the next 2 weeks.
Okay, I'm Tonya Spanglo and I'm down 230 pounds. I had gastric 4 years ago and I'm about to go through my very first round of plastics. I'm having a breast lift with a fat transfer. So they're going to transfer the fat they take from my belly and my liposuction areas into my breast because I didn't want to get implants. I'm also having a fleur-de-lis and I'm having a lower body lift. I'm super excited.
How exciting.
I'm nervous, but I'm excited.
Mm-hmm. Okay, and then Teresa, tell us a little bit about where you were, and you've already had one round of plastic, so tell us a little bit about that and what's coming next.
So my name is Teresa. I've lost 460 pounds. I had gastric bypass surgery almost 6 years ago. Last year, I had 47 pounds of skin removed from my abdomen. I had an abdominoplasty surgery with a fleur-de-lis with muscle repair and liposuction. Totally life-changing. I'm getting ready in, I think it's 9 days to have my second round of plastic surgery. I am having a full thigh lift, and they're also going to do liposuction as well. And I'm so excited for Tonya as well, because I know firsthand how transformative this surgery can be, not just physically, but mentally and emotionally. After losing a massive amount of weight, you are evolving into the next phase of your journey, and it is so incredibly beautiful and powerful. I'm covered in chills. I'm so excited for both of us, but I am so excited for you because round one is unlike anything you're going to go through ever. It's amazing.
I cannot wait. I'm nervous, not for the surgery. I'm just nervous for the recovery.
The recovery usually is the scariest part. And what you have to know is it's temporary. The pain, the discomfort, the inflammation, the swelling, all of it's temporary. And you just have to gung-ho it, go through it. And on the other side of all of that discomfort is your brand new life, really. I would love for you, Teresa, to go into the details because I talk about this on the show all the time about the magical transformation that goes on inside of us after surgery. And I know over the weekend we were together and we talked about, you were telling me about the 6 years of your journey and how in the first years were losing the weight, but how much it has changed from the day of the skin removal.
For me, so, if you followed my journey, I had the 47 pounds of hanging skin that went down to my knees. So it inhibited my life in a lot of ways, physically, emotionally, mentally. In so many ways, I felt like I was still carrying around the reminders and the part of me that I tried to let go of, all the pain, all the things I had held on to. And so for me, going to sleep and waking up a few hours later and having that skin removed, I remember waking up and just sobbing because it was so powerful for me. It's very symbolic of your journey, of all the hard work you've put in to transform yourself from the inside out, and to see all of your efforts visually represented on your body is so incredibly powerful and moving. There's nothing like it that I've experienced. And the first several years of my journey were really hard. Of course, I'm transforming my life. I'm trying to shake off old thought patterns and behavior patterns. But there's something to be said for this like last stretch of my journey this past year, because the ways in which I view myself, the ways in which I move through the world, the ways in which I interact with others, the way that I make eye contact with people, how people make eye contact with me. I have men opening doors for me, talking to me, smiling and flirting with me, like people complimenting me nonstop on, you're so beautiful, you shine, your body is this, that. And it's not just about the way that I look, but it's the fact that I hold my head up higher now. I can see my shape since I'm over a year. It took about, I want to say for me, probably 7 to 8 months before I really started to feel like I was looking fine. Like I started like playing with fashion this year, right? I started playing with my clothes, which something I never could do. I dressed to cover my body and to be invisible. And now if you see me, my outfits are popping. Like I'm intentionally putting a lot of effort into my physical appearance because I'm so happy on the inside. And so now I can reflect those changes with my body, and being able to date for the first time. I haven't dated in over 20 years. I was not able to see my lady bits or my lap for over 25 years of my life. And now when I look down, I'm like, oh my God, I have a lap. I can see my vagina. I can see everything. Like I can use all these parts, and there's something so freeing about it. I don't care. I don't walk in every moment thinking about my stomach hitting my legs, thinking about the fact that everyone looks at me and thinks, well, she lost all this weight. Why does she still have all that right there? Like I'm free from carrying that around with me physically and emotionally. So it really has enabled me to be totally present in the moment and to be able to notice that people do treat me differently. But more importantly, I treat myself differently. I feel differently. I think differently. I act differently. I'm a totally different person even today than I was a year ago. And a lot of that is due to the freedom of having that skin removed. So it's life-changing, and I can't wait for my bestie to experience this. It makes me get super choked up because I know what she's about to go through. And I'm so glad that she has the support system that she does.
You know, over the weekend, and let me tell my girls, who's listening, over the weekend, I got to be in person with these two ladies, and we were walking down the hallway of Dr. Rednum's office, and we had just finished her consultation, and I was walking next to Teresa, and I was telling her, you know what? You're going to have to pull Tonya off the tabletops after she's done with surgery.
Yep, you did. And I said, yes, we will.
Because
I don't know about the tabletop, but
yeah, you're going to be so in love with who you are after surgery that you're going to be doing things that you never thought you would be doing. Teresa has said it herself, things that she never imagined she would be doing. Now she does so freely and openly without thinking about it. And that's going to be you after surgery.
yeah, I love how Teresa said that before we used to cover our bodies up because that was so me. Like I was in a 5X and an M section before, and so fashion has never in my entire life been important to me. Never. Like I can look back at all the pictures. I'm dressed in black, or I'm dressed in the florals, the polyester peanuts that my grandmother wore, that I wore, and I was only in my 20s or 30s. Fashion was never for me because I just thought no one wanted to look at me. I didn't even want to look at me, and so why would anybody else? But when you said you dress to cover up your body and now you don't, I feel that. Like I feel that now because like right now I have my shirt knotted up to show off my waist a little bit. I've got the cutest little flare leg pants. And so I think after this surgery, like Mavi, you're right. I'm going to be like, even my husband, when I was telling him like this is going to be snatched and these are going to be up. And he was like, what am I going to do with you? And I was like, I don't know, but I'm imagining something amazing.
All the things.
Really good. So
All the
I'm
things.
super excited. Yeah. I think it's going to be, for me, the skin removal is just like we described this weekend. Like listening to Dr. Eric Smith talk about how body dysmorphia takes effect, and it's a real thing for everybody. And then Dr. Rednam coming on and saying this is a gift that you give to yourself after losing all of the weight. For me, it's the weight is the symbol of the old me. Like it's the old me that I think I'm secretly holding on to, because she rears her head every once in a while and she tries to bring back those old habits that I've tried so hard to kick. And she tries to bring my mindset back to a negative mindset of, oh, well, you're not skinny. And I didn't have weight loss surgery to be skinny. I had weight loss surgery to prolong my life. I was on 2 blood pressure medications and I was on 2 different cholesterol medications, and I was always borderline diabetic. And I'm none of those things now. I have no prescription meds. Like, I only take vitamins and Prevacid. Like, that's basically it. And a stool softener. That's it. And so I've really bettered my health when you think about it. And like, it's never been about what the scale says. It's never been about what size jeans that I have on right now. It's been about how I look at myself and how happy I am because I can move freely and I can go throughout the grocery store without people looking at me in disgust and looking what's in my buggy and, oh, we're not buying that because look, she's morbidly obese and that's how her family eats. Or stares at a restaurant because I shouldn't be eating because for some reason society thinks that if you're obese, you shouldn't be hungry. And I was hungry. And just the stares, and it's just all those things combined that really weigh you down. And I think that that's my skin. My skin is weighing me down. It's keeping me with one foot in the past and one foot in the present, keeping me, the old me and the new me. And I think when I just get this skin removed, I think I'm just going to realize like how amazing I am. Because like you guys tell me and my husband tells me and everyone tells me, and I do know that I'm amazing, but this skin every day holds me back. And I know people think it's a badge of honor and you should wear it proudly. And I have wore it proudly, but I don't have to do that anymore. Like, I have the opportunity to let it go, and I want to, and I'm going to. I want to, and I'm going to.
You're going to notice how your life just skyrockets. Not that you are stalled, but there's something magical that happens when all of this mental space that used to be taken up with worried about what you're wearing, how you look, if people are looking at you, all of that is going to be free. And now you're going to be like,
I can't imagine that.
You're going to walk in your closet and pick out your outfit and know that it's going to look good. And you're going to walk out and feel super confident in it and look and just feel amazing in your own skin. And I'm so excited for you, Tonya. Like I told you, I can't wait to be with you the whole journey, just knowing that you're going to be a completely different woman the next time you talk on the show in a year, when you're 1 year post-op and you've gone through all of the surgery, gone through the recovery, gone through the inner transformation even more than you already have. I can't wait. I always like to tell my girls, I can't wait to see what you get yourself into after surgery. I can't wait to see who you become and how your life changes, because I know it's going to happen. I know it's going to change. I know something really amazing is going to come from this. So I'm so hopeful and excited for you. So for this episode, I want you guys to ask me the questions that you have been thinking about, Googling online, thinking, what about this? What about that? I'm an open book, and ask me your questions. Whoever wants to go first, go first.
I'll go first real quick. Because probably. Okay, girls. So my biggest thing is I have been in a new relationship for the past 7 months. Okay. And like I told y'all, we smash twice a day. Okay. In some way, shape or form, we are engaged. We are engaged in adult activities constantly. And I don't know how long we can both go without that. So what I'm wondering is, I went 20 years. Okay. So like, I don't want to kill any more time. So I'm having the full thigh lift. Okay. So like, okay, how long do I have to go before I can have I want to say penetration, straight up sex, but also any kind of stimulation down there? Like, what? Give me all the details, because I need to be able to tell my man too.
I'm gonna
Wait,
give
let me
you
get a
my
pen so I have this
professional.
down.
I'm gonna give you my professional opinion, and then I'm
Yes.
gonna give you my. Okay, girl, if you're gonna do it, at least do it like this.
Perfect. That's exactly what I need, because that's probably option 2 will probably be a reality.
So my recommendation would be, my professional recommendation is to stay away from sex for at least 6 to 8 weeks, especially in your thighs, because you're going to have those long incisions down your thigh. You're going to be tender. You're going to be sore. The thing with thigh lifts is that it's not really muscle pain. Like, with your abdominoplasty, that pain was muscle pain. That feeling of like you can't cough, you can't laugh, you can't sneeze because it hurts. With thighs, it's more of a skin surface pain, stinging, burning, just sensitive sensations on the surface of your skin. So
when you say no sex for 6 to 8 weeks,
When you said that,
can you be very
oh,
specific? Like
okay.
any activity, I'm talking like down, no stimulation like down there at all.
Okay, well, you're going to be the judge of how comfortable are you in the different positions of your legs. How comfortable are you going to be, like, to fold your legs up? Is that going to be uncomfortable? To open your legs? Like, how are you going to feel a stretch? Like, you might open your legs and feel stretching. And this is what I like to say, if it hurts, don't do it. If it feels like it's hurting, or you're feeling tension, or you're feeling pressure, don't do it.
Okay.
Now, my girl talk, like, if you're going to do it, at least do it like this. There's fajas that have the hole in the middle. You're going to be wearing a faja, a compression garment, for those who don't call it faja, or you might call it faja, or whatever y'all call it. You're going to be in a compression garment for your lower body. So most likely that compression garment's going to go below your knee up to your waist. So the compression garment that you pick, if you pick the one that has the opening, the crotch opening, then you can have some sort of activity in your faja, like very, very carefully making sure that you're not feeling any pulling, because what you don't want is for that incision at the midline and the inner thigh to be pulled, because when you're feeling pulling or stretching, you really are pulling and stretching, and that's what makes your scars get wide.
Okay.
So if we don't want wide scars, then we have to not pull on it or make any pressure, because it's not like you're going to pull it and it's all going to unravel and it'll be open. You can have wider scars. Your scars might get raised, more inflammation, more swelling. So maybe you could have some sort of activity, some oral activity.
Yeah, for sure. Yeah.
But here's the other thing. The inner thigh lift is one of those areas that sometimes has trouble, because you're peeing, you're going number 2, and you have to keep it really, really clean. All of that area has to stay really, really clean. And I've seen where a patient, we talked about this in a previous episode, where she was like 3 weeks or 4 weeks after her breast augmentation, her husband was sucking on her nipples and she got an infection in her implants.
Oh, wow.
So that makes me cautious to any activity while you're healing, while your incisions are healing, that could cause some sort of an infection.
Okay.
By accident, something getting spread, spit, saliva getting spread somewhere that could end up in your incision. So I would say stay away from any type of activity for at least 3 weeks. If you're going to be doing something, stay in your faja and keep your incisions completely clean, not getting anything on them.
Like health and safety are obviously my first priority, but it's good to know, because my doctor is male. He's amazing, but his perspective and his advice was different than what you just said.
Follow your surgeon's orders, but
yes,
I think if I remember, he told you less than what I'm telling you.
It was less than what you said. Yes. So, I of course will follow my surgeon's orders, but being cautious. I will err on the side of caution when engaging in any kind of sexual activity during my healing phase.
Yeah. Just if you feel pulling, if you feel stretching, if it hurts, if you're kind of like, I don't know, don't do it. Tell him, hold on, baby, wait for me, okay? Just give me a few more weeks. I'll be ready for you.
And that'll make it that much better anyways.
Yeah, I've been telling him that too, and he's so supportive. He'll be fine with it. And there's other things you can do, there's other things we can do to keep it fun.
Exactly.
For sure.
So, but for my girls out there who are they're having this, trust me, every single patient asks this question. When can I have sex again? How soon? Can I have any type of activity? Can I have anything? And it's usually the same question, like, okay, if I can't have sex, can I have oral? If you have a tummy tuck, that's fine. But for a thigh lift, you're so close to that area, I would stay away from oral too. At least until your incisions are completely closed, healed, the scar, there's no scabs, it's closed, and you're good to go. Okay. She's like, dang, that's a long time.
But you know what? I waited over 20 years. I know. Mavi, what are you doing to me, girl? No, but I waited so long to have sex. Like, this is going to go by in a blink of an eye, and it's going to be that much better because even like now with the loose skin on my thighs, it's not that bad. My boyfriend's like, baby, you're fine. But like, I know that like when we go to have sex, I'd have to lift up the thighs a little bit, like just to make me comfortable, like to get into position. You know what I mean? And I won't get too graphic, but like, you have to lift up the thighs a little bit. And I don't want to have to do that. And so for me, this surgery is going to free me of that. It's going to make me feel beautiful. It's going to make me feel sexy. It's going to give me the thighs that I've always wanted and never had. So I will happily wait and follow the orders and just play it safe.
Play it safe. My recommendation is like with tummy tucks. They are ready, right? They're ready. They don't feel like they did 2 weeks ago when they couldn't even walk. Now they're feeling more up to it. They're starting to go back to work. But you can pop a stitch. You can, like, on the inside of your abdomen, you can pop a stitch. On your thighs, you can pop, something can come undone with a lot of activity and a lot of movement. And what you don't want is to take steps backwards.
You definitely know how to get an infection. That scares me a little bit.
Yeah. The inner thigh lifts are kind of one of those areas that are very prone to getting an infection. And inadvertently, just because you're in your, if you stay in your faja and you keep your incisions covered with gauze or with ABD pads so they're double protected, you should be fine. And making sure you can also use a urinal, the little funnels.
And
I bought one of those. Yeah. I haven't practiced yet, but I'm going to. Someone told me that because if you stand up while you urinate, not only it's going to be easier for you, right? When you're getting up and down, you don't have to get up and down off the toilet, but like it'll keep everything streamlined away from your body.
Mm-hmm. I had a question about the vagina. So Dr. Rednam explained it to me that when she does the lower body lift, she will lift it all up. And so I'm thinking the way that she described it, and we talked about it a little bit, but not that much. I have like I say it's like an awning. I have like a little awning above my vagina. I know that's like, that's really what it is. Like it shades it. It keeps the sun off of it. And so I think that that's going to be lifted up. Well, so when that's lifted up, then my vagina is going to be lifted up. It's like I was trying to explain this to my husband, and he was like, what do you mean? Like, your vagina is just going to be like right there? And I was like, I'm not sure. And so is it or is it? Like, is it going to be, are we going to have to do like completely different positions? Like, is it going to be up and out? Like, here I am, look at me. Or what is it going to be? I'm so like, I don't know how it's going to be, but I'm excited.
Okay, so you know how, like, your whole, like, the whole area kind of is pointing down, right?
Mm-hmm.
Like the skin above your lips, all of that, right? So that gets lifted, that area. So imagine the skin above your lips pulled up, up to where close, depending on how they do your incision, it'll be to cut off a good chunk of skin to make it all look even without having like a transition. They also do a little bit of liposuction there to make sure that it's flat with your abdomen. So it's not like I'm sure you guys have seen it, and it's something that pisses me off every time I see it, because it's like, that was a man who did that surgery, and I can tell, because if it was a woman, she would have liposuctioned that area.
Uh-huh.
Where sometimes women, not by their fault, by their surgeon's fault, will have a surgery, and like a tummy tuck or a fleur-de-lis, and they won't liposuction or lift the mons. That area is called the mons pubis. So they will leave it alone. They just don't bother with it. And what happens is, these women, it looks like they have a package, because all
She's
of that is
lifting
still
that.
there. Yeah.
She said that she's lifting that.
Yeah. So Dr. Rednum is going to probably debulk that. So maybe do a little bit of liposuction or trim some of the fat and make that even with your body. So if you can imagine, if you want to stand in the mirror and like look at yourself and pull that skin up towards your hips, like towards your body. And until you feel your body, like I'm doing it right now. I feel like my hip bone, I'm pulling it from the sides up. So I can feel my bones. So that's how it's going to be.
So that's how it's going to be?
Yeah.
So it is going to be raised.
It's going to look a lot different, Tonya. You're going to be like, oh, hello. I have not seen you like this before.
Right now, I can't see it.
You'll be able to see it.
You're going to be able to look down and be like, hey, baby girl, I haven't seen you in years.
I shaved there. You can see it now. Like, I can look right down and be like, oh my God, she's right here. I have never seen her before. Like, it's crazy. And she's right there.
That's why I was trying to explain to Bobby. And he was like, what do you mean? Like, she's just going to be front and center? And I was like, yes.
Yep.
I think
well,
so.
like,
she'll be ready.
When you're a bigger girl, you kind of got to, like, search for it because it's way down there. But now, he doesn't have to search for it. It's right there presenting herself.
X marks the spot, baby.
Exactly.
You know what? Even though I didn't have weight loss surgery, I had pregnancies that I gained a lot of weight with my pregnancies. And with that weight came extra skin. And I remember after my mommy makeover, still like groggy and still halfway under anesthesia and going to sit on the toilet and looking down and be like, oh my God, I can see her. She's right here. Right? I don't even have to pull up or anything. It's right there.
The first time I saw it after my abdominoplasty, I swear to God, I sat there staring at her for like 30 minutes. I just like mouth wide open, like, hello there.
How easy it's going to be. Like, it's going to be so much easier to like tame yourself or whatever you say.
Yeah.
And it's going to be so much easier. I've never had that ever. I've always had skin out there. So when you look in the mirror and you can't see it, it's covered. And so for her to just be front and center as soon as that's going to blow my mind, I think.
It will.
I think you're going to be mind blown with the whole thing. I was watching your live this morning and I saw where you were like, so none of this is going to be here. And you're like pulling all your skin in and you're like, look, I have a curve. And you're going to be able to stand in front of the mirror and see all of that curve, all of that. It's already there. Your foundation, like I was telling you over the weekend, your foundation is beautiful. And after this surgery, you're really going to be able to see it because all of that extra skin that hides it, it's not going to be there anymore.
No, I've never been able to see it. So I think that's why it's going to be so shocking to me because I've always been overweight. And so like my mom, everyone was always like, oh, you look just like your mom in the face and you had your mom's dark hair. Well, my mom had a tiny little waist and big old broody hips. And so neither one of us girls, my sister or myself, we were like, well, I got mom's face and hair, and Tiffany looks like mom a little bit. But honestly, I literally did get my mom's waist and hips. I just didn't know it because I was so obese that you couldn't see it. And now I can see it. So every time I look at my waist, and like right now, I have my hands around my waist. That's my mom's little bitty waist that I've had this whole time, and I just didn't know it. So that's special to me, you know?
So what other questions did you ladies have?
I had a question about nutrition. You were telling me over the weekend about my protein, and they mentioned that this morning on my consult with Dr. Redham's office, they mentioned protein afterwards, how sometimes you might not have an appetite, but it's super, super important what you eat after surgery. So can you tell me a little bit about more in depth about that?
Bariatric patients already notoriously are prone to having wound delays issues with their incisions closing. And also, I want you to know that this doesn't happen at the beginning. It doesn't happen in the first week or the second week. It usually happens in like week 3 and 4. Once you start to think, oh, I'm doing good, my incisions are closing, everything's great, I can go back to my old way of eating, or I'm not really hungry, my stomach is too tight, my abdomen wall is just too tight, I feel full. Because you might already feel that now, but after surgery, when you have abdominal wall repair and it's tight, like an inner corset, in there, you might feel even tighter, and you might feel like, I can't eat. But what you have to know is that it's very, very, very important for you to maintain your protein intake and keep your calorie intake above maintenance level for at least the first 3 months.
So like,
And I did not do that, Tonya. I struggled. At week 3, I stopped eating and drinking because it was hard for me. They were trying to force me to drink my shakes, to eat my protein. I couldn't do it. And I wound up in the hospital with a pulmonary embolism in my lung and almost died from it. So I can literally personally attest to the fact that it can save your life. You have got to eat and drink and make sure you're hydrating, getting your protein. It literally almost killed me. And it wasn't because I was trying to be difficult. I didn't feel good. My stomach felt full. It was really hard for me. And as a bariatric patient, I struggled even more to be able to, because we can't consume large amounts of food at one time. So I agree, Mavi. It is so, so important to be able to hydrate and get your protein in.
But just eat the same amount of protein grams like a day, or should I up it?
I think you should up it. So with your POP recovery system, your nutritionist is going to give you your goal calorie intake, your goal protein intake for surgery recovery. So she already has that ready for you. She'll have that ready for you so you can know, am I meeting my requirements? Am I getting there? And as you two ladies are like professionals at this, now that you know ahead of time, you can come up with a plan of like, okay, I can at least, for example, those treats that you love, that you know you can eat no matter what, like that cottage cheese, blueberry, grape thing that you were showing me, giving yourself like, okay, I know I have to eat, and I will eat this even if I'm not hungry, or if I don't feel like it, or I don't want to. One of the things that I like to tell my girls is you have to think about it, really plan for the future, plan for success, because you will not want to. You're going to have to force yourself to. And I notice with my girls during the recovery, your body is healing. So a lot of your energy and those calories, your body is taking them to heal your incisions, to heal your body. And you get so tired. You feel like, I have so much energy. Oh, no, I don't. I'm done. A couple hours later, that's it. You can get so tired that even chewing is like, I have to chew. Like, oh my God, I don't want to chew this.
I was just going to say that it felt like a task, but you know what? One thing I will say, when I went through my abdominoplasty last year, while I had support from family and my medical team, it's not the same. Like now that I've been going through the POP program, I literally know that I have a game plan for exactly how much I'm supposed to eat. I'm not trying to Google it and figure it out. It's like that Melanie is helping me figure it out for my body, my protein, my fluids, telling me things that I should cut out, telling me things that I should add in. Like I wish that I had that when I went through my abdominoplasty surgery, because I feel like maybe it wouldn't have almost killed me. Maybe I wouldn't have gone into the hospital. You know what I mean? Like I would have known exactly how much I was supposed to eat of my protein and to hydrate. So this time around, I feel a lot more confident that I'm going to be able to tackle my recovery and go through it successfully without complications.
I'll have my nutritionist appointments. I think that's tomorrow. And then the same thing, my mental health, and then the concierge. They did my Airbnb, so I've got to get all the confirmation on that. So I haven't had my appointments yet. That's probably why I don't know those appointments as well. They give me a list of things I have to get off Amazon.
I want to ask you guys, because for my listeners, you guys know that I've been collaborating with the POP recovery systems. And over the last year, I helped develop the concierge wellness program, where I took all of my experience as a patient coordinator, as a medical assistant, as helping everything that had to do with patient care during their recoveries. and I help develop a program to help patients through their preparation and recovery. And so I really want to hear from you guys. What do y'all think so far, going through the program and everything that Laura and I have been working to put together?
Oh, I love it. Teresa, if you want to say something too, I love it. I feel like it is a best friend, like holding my hand through the entire process. I didn't have this with my weight loss surgery because it wasn't around yet. I wish I would have, because I really feel like I would have been successful sooner. Like, I'm 4 years out. I think I could have gone through these stages like sooner. But yeah,
Yes.
the pop system, they mentioned things to me and answered questions like I didn't even know that I had.
Yeah, for me, so talking with Chrissy, she's the concierge wellness girl that I've been dealing with pop recovery, and it's been amazing, every aspect of it. But what I love is that she's asking me questions like, the last time when I had my abdominoplasty surgery, I stayed at the Hilton. Well, that was hard for me, having to maneuver, going through the check-in, through the checkout, my family having to go through the lobby, all those things. And so she's like, what about an Airbnb? She's gone so far as to ask me, okay, well, your boyfriend is 6'3", so like we need to make sure that you guys have like beds that are that fit you guys. Are you going to have twin beds? Are you going to share a bed? Like, what kind of flooring is in your home? Do you have rugs? Do you have dogs? Which we all know I have an arc. Like, do you have railings in your bathroom to grab onto? My boyfriend built our bed for the size of a giant. So I'm like, how am I going to get in my bed out after recovery, right? Like,
Right.
She's like, okay, you're going to need some kind of a step ladder. You're going to need assistance. You're going to need to either have a care plan for your animals, or you're going to have barriers to keep them safe from you because you don't want them jumping on you. I would not have thought about all of these things. She's talking about, okay, does your boyfriend know what to expect with this during your care? Like, who's going to be getting your medication for you? Like, what about your meal prep? Like, literally, she's asking me all of these things. I feel so supported and informed. Like, now I'm like to my boyfriend, I'm like, baby, you got how many days you need to block off the bed? You need to block off the door because those dogs are not coming near me. So like, we have a game plan now. Whereas going into it, we're not going to be dealing with it while I'm recovering, which would stress me out and him out. Everything will be prepared ahead of time, which makes me go into this surgery feeling empowered and prepared so that we can just both focus all of our energy and efforts on me healing and not having to deal with problems like that as they arise. So game changer, a literal game changer for me. Like, my stress relief is like exponential with this. Like, seriously, so much, especially with the dogs. I'm like thinking about the dogs alone jumping on me and like with my incisions. Oh my God, that terrified me when she said that. I was like, oh, I got you. We'll handle it. Now I know. Like, now I know.
Yes,
That
the
makes me
stress
so
relief is
happy.
what I was going to say. Like, the stress relief of it, they were asking me things like she rented an Airbnb, and so she needed the exact address of where Dr. Redden's is, so it's like as close as possible. And so that's already
Yes.
like taken care of. I don't have to worry about all that. And then the Amazon list of things like a raised toilet seat, but then is your toilet round or is your toilet oval? Like, all the little details that I never would have thought of about my recliner, because I have a sectional. So the recliner is on the end of our sectional where I need one that like rocks me up. I don't have that option. And so they told me about how you can get a huge cushion that fits in the recliner and it's hard in the middle. So it feels like you have that rock up recliner. So many things like that, like the compression socks that I need afterwards, all kinds of things that I would not have thought of. And so for me, it's making the transition phase from bariatrics to plastics. It's making that transition so much easier than I thought it was going to be. Little decisions, they're holding my hand through, asking me so many questions. Stacy asking me, like, she sent me a text message yesterday. She's messaged me this morning. That's the mental health that I'm going through the process with. And she's like, I know how you're feeling right now, and we're going to talk about it. Like, you can do this. You're strong. You're a warrior. Telling me all the things that I know, but she's just making me feel really good. And mental health is a huge part of it for me, because having a positive mindset and keeping a positive mindset through surgery, and just talking to you, Mavi, and you saying, like, you're not going to want to, but fix yourself. And like, you're making me have a plan. Like, Melanie, my nutritionist, we're going to visit tomorrow, but we've already talked about having a plan. Like what you're saying, Teresa, like, go into it with a plan, and then you won't have to worry about all these things while you're recovering because you'll already have the plan. And so it's going to make the recovery process so much easier. I'm super thankful for pop recovery.
Yeah, what Mavi was saying about not having the life energy to deal with those things, like literally chewing is hard after surgery. So like having to deal with all those other things makes it so hard. And I think what you were saying about like the mental health too, like the getting your mindset in a place that is supportive of healing is so important. Like I'm already visualizing how I'm going to feel, where my recovery space is going to look like, the kind of mood and tone that I want to set in that space. And they started me on that weeks ago, helping me to manage my anxiety with all the transitions that I've been going through in my life the past 6 months. But in order to get me to a place where I'm present in the moment, where I'm focused on positivity and possibilities and the fact that my healing journey, that I am capable of having a positive experience through this surgery. And I would not be in that mindset if it had not been for Stacy and for Zena, who work with the mental health and pop recovery. Literally, like it's helped me through more than just that. Honestly, it's helped me through moving, through resigning from my job, like, and all of that leading up to my surgery. I feel like could have been weighing me down a lot, but it's not now. Now I feel I'm looking at it all as being empowering, that I've made all these decisions. I'm moving forward with the next round of plastics and I'm ready, and I'm not doing it alone. I have an entire team of strong people who are empowering me and uplifting me every single day. So I'm here for it.
I'm so happy to hear all of that, because you guys, let me tell y'all that 2 years ago, this did not exist. 2 years ago, having a support system, a whole team to help you along your surgical journey did not exist. And it was at the same time so needed. And it wasn't until really Laura and I, our missions aligned and our passion aligned to help women have a successful, peaceful transformation journey, that we were able to come up with everything that you guys just mentioned. The plan, when I was training Chrissy, I was telling her that we want to think about the things before they think about it, so that they don't have to think about it, because we already took care of it. It's done. They don't worry about it. We want them to feel as relieved from stress as possible. All we have to focus on is healing, is eating, is sleeping, resting, watching whatever they want to watch, reading whatever they want to read, and making sure that they feel really comfortable during their recovery. So to hear it from you ladies that it's working, it makes me feel so empowered and so happy. I feel like I really helped the community.
Yeah, it's like,
and this is just the beginning, right? Yeah, sorry, Tonya. This is just the beginning. You know, over the weekend, I was telling you guys about how when I had the pulmonary embolism and I had to call for 911, and they came to the house to help me, which they're all amazing first responders, but they were all men, and they treated me like I was having a panic attack because I was in a faja, and they were like, "You're just having a panic attack. You're female hysterical. Like you're not handling it right." I wish that I had this team, because I could have called one of you guys. You would have supported me through it, and they would have been able to tell them, look, no, she's not hysterical because she has a faja on. She's hysterical because she probably has something medically going on and she can't breathe. Just like going through the airport, I was on my way home. I have my faja on. I was pulled from TSA pre-check-in and made to wait and go through a full body search because I had a faja on. Had I had somebody on my team who I could have, you know what I mean? Like things like that, where people don't think of women or men going through these kinds of things, dealing with situations like that. I felt helpless. I felt scared. And, knowing that you have a whole team there to support you, like it's everything. So I know this time around, if something goes wrong, exactly who I'm calling.
You already
right. So comforting.
Speak out.
Yeah.
Mavi,
Help.
I need you.
Yeah. Yes. Speed dial.
Speed dial. So, okay. The question was about eating after surgery, right? Very important for you to eat above maintenance calorie intake, up your protein. I read a lot of surgeons' pre and post instructions when I go over them with my girls in our one-on-ones, where I read surgeon recommendations of adding an extra protein shake every day for 3 months, it being additional on top of everything that you're eating, adding the protein shake. I think that is a really good tip. The other thing I want to talk about is your pets. So I did a whole episode on the importance of maintaining your recovery area clean. while you're in recovery. Especially, let me tell you, I had a case maybe like 12 years ago of a patient who had an infected tummy tuck incision, and we couldn't figure out why was she infected? Where did it come from? And it wasn't until the doctor swabbed it, sent it off to check what is this bacteria, and it was bird feces. And it was the patient had a bird that flew around during her recovery. I know, I hear Smokey, that's why I'm telling you.
I know, I hear Smokey too.
That nasty little heifer flies all over the house. My boyfriend lets him sit on the couch with us. Like the places where I will be recovering, like he brings, we have to have a phone call with my boyfriend so he knows not to put the bird everywhere. Oh my God.
You're going to have to maybe have like a specific room in the house that is your recovery area. Clean with a door. This is what I like to tell my girls. A place with a door that your pets can't come in, that it's just for you, just for your recovery. Keeping it super clean, wiping off the door handles, anything that you could touch and then touch yourself, keep it clean.
So my dogs sleep in our bed with us. They sleep, okay, I'm not kidding when I tell you one butt cheek has a dog here, the butt crack here. Like my dogs, literally, my boyfriend's up on one side, the dogs are up against me on the other. So how long do they need to remain out of the bedroom until I'm totally, completely healed and everything is all good? Okay.
I would say at least stay away from your dogs until your incisions are completely clean. Completely healed. And keep them clean. I've had patients cancel surgery because they're like, I can't not sleep with my dogs. And I'm like, okay, well, you can't sleep with your dogs while you're in recovery. And they're like, okay, well, I won't have surgery. Okay, then don't have surgery because you're going to have the surgery and you're risking an infection, a massive infection that could change the trajectory of your recovery with this.
That's so good to know because I mean, obviously I knew about the jumping on me and stuff, but like I need to make sure that my bedroom is the sacred healing space, the place for me to rejuvenate and heal. And my life is just the way that I am, as my animals are a massive part of my life. They're my babies. And, so yeah, I think that helps me so much. Now I know I can prepare for that too.
I like to say a recovery room area with a bathroom that you can easily walk to, is the best. If you have up and downstairs, make it downstairs so you're not going up and downstairs. Or if you are upstairs, make it to where you have the bathroom upstairs so you only have to come down to eat or something like that. But it's very, very important in those first 6 weeks to make sure that your incisions stay clean and healthy and free of bacteria. And just always remember, like, wash your hands after touching things. Like, if you leave your recovery room and you go out and you're walking around the house and you're touching things, wash your hands, hand sanitizer, making sure that when you go back to your recovery area, you're not wearing the socks that you were wearing out there and then getting in your bed with those same socks.
With all the dog hair all over me like I do.
Things that you don't even think about. Like, I never thought about any of these things. I don't have pets, but I would never think about all of that. That's such great info, Mavi. Like, it's so helpful.
Do you see my face? I'm like, I'm like, oh my goodness, because I'm covered in dog hair every time I walk out of my room. This morning I was telling you girls how I went to feed the dogs and a snout ran against my stockings and I had stuff all over. So yeah, that is something that I have to really.
If you have somewhere that they can live for like 3 weeks so you can keep them away from you, because it's hard with dogs. They listen, but they're not going to listen. They don't understand.
They don't. My little pit bull is a talker. And so she will be, I won't do it on here, but she will be yelling and crying because she has slept against mommy since she was 8 weeks old. So she's going to be very vocal, and it's heartbreaking when you hear her. She's not going to take it well.
Oh, well,
maybe you can start to like wean her. You know, because they're like 8 days out, right?
That's starting right now, today.
Like wean her like tonight. Start it.
Yes.
Yeah.
Mm-hmm. So that makes sure you have surgery won't be as bad.
Now that I have the information, that's exactly what I'm going to do. I'm going to use it.
Right. Wash your sheets, pillowcases, clean your floors, wipe off all the counters, all the doorknobs, everything in your recovery room, in that area where you're going to be recovering. the shower, get the shower clean, make sure it's like good, because you just want to make sure, be over protective,
Right.
over than under, because then you don't know where a bacteria could come from, an infection can come from. And what we want is just for you to heal peacefully and with no infections, no issues.
Thank you, Mavi.
Dog hair can get everywhere. You guys know dog hair can get everywhere. So, before we go, you ladies, do you have any other?
As the dog busted in the room right
I
now.
was like,
She pushed the door open. She heard us talking about her. Pushed the door
You're
open.
kicking me out of the bed. Oh
For
no!
real,
I don't
that
think
door was
so.
shut tight. She just heard it and pushed it open.
You literally
It'll be
was like,
okay, girl.
You thought, what's this?
Exactly. So, before I let you ladies go, do you have any other questions that you're like dying to know, that you've been Googling, thinking about?
Yeah. The only other thing that I was wondering about was, comfort wise, when I'm recovering in my bed, like, do I need to get like the pregnancy pillow? Cause I know every surgery is different. For my abdominoplasty, I've recovered in a recliner, but for this one, I'm not living in the same place. I don't have that recliner. So like, what's going to be the best thing for me as far as being comfortable during recovery?
I think for thigh lifts, it's not, you don't have to be like bent how you are for a tummy tuck or for an abdominoplasty surgery. I love Smokey in the background. So making sure that you're comfortable. It's an area that's comfortable and that you don't have to, like, for example, you said your bed is high. Like, it might not be comfortable for you to have to fold your knee to get up on the bed. You know what I mean?
Yeah.
You know how when you go up on the bed, you have to fold your knee and kind of get on your knees to get it on there. That might not be very comfortable for you, because that might feel tight, or it might feel pressure. The same thing as I was telling you earlier, if it hurts, don't do it. You can try maybe a lower sleeping area until you feel like comfortable enough to get up there.
Okay. Thank you. That helps.
I know you're like, dang, we got a high bed.
We do. That's the only place I have to sleep, because keeping the dogs quarantined is going to be in the living room area, which is where the couch is. And my bed is the only alternative that's it. So I'm going to have to figure out a way to make everything work. So this is why all the information is so important. This is why talking to someone like you who has all this knowledge is important, so that I can be prepared and not be freaking out coming home from surgery and not having a place to sleep and having the dogs laying up in my bed and then crawling up into the same bed when the dogs have been in there with their dirty paws. Like, this is eye-opening for me. I'm literally going to like strip everything and like isolate the dogs starting today. Yeah.
Like, you know, it's sad for my pet owners, because they're like, what? I can't sleep with my dogs, but it's for your benefit. It's to keep you safe, to keep you from having any infections. And the other thing is, dogs lick, right? They lick on things without, sometimes you're like, wait, quit licking me, stop. So that's another thing to think about when you are around your dogs, letting them lick you. Like, if they lick your hands, make sure you wash your hands before you touch anything on you. And just stay away from them for like I would say at least the first 3 weeks.
Okay. Thank you, Mavi.
Till your incisions are closed. Once you see that your incisions are closed, you're good. Okay, I'm good.
Okay.
But if they're still fresh, like they're still healing, you can still see blood, you can still see red, then stay away from them.
So about how long does it take for your incisions to close?
They start closing by 2 weeks. You see like they're closing, they're healing. By 6 weeks, they should be completely closed. Okay. So it depends on how you heal, how much protein are you taking, are you doing a good job with your calorie intake. That's what kind of determines how fast your incisions close. So,
okay.
Good information. Honestly,
yes.
Right? It's really good. I love to talk to someone who knows so much about something I'm about to go through. Like, I love that. Thank you so much for taking your time to do this today.
I love you guys. I am so happy to be a part of your journey and to be a part of your podcast and launching your podcast, helping you launch your podcast. It has been such an amazing journey for me, because it helps me expand and help other people raise their voices and help a big community, an even bigger community. And that just makes me feel so happy that I'm even able to do this. I started with, I have a mission. There's ladies out there that need me. How can I find them? What can I do for them to find me? And that was my mission. Like, okay, how do I find them? How can I make it so they can find me and so that they can find the good information that they need, so they're not on Google, they're not, Googling something and Google's telling them they're about to die. How can I help them find the information that they need that's actually good information? And that was my mission. I left the gate thinking I need for them to find me and I need to find them. And slowly we built this community of women who just empower each other and do nothing but encourage and support each other. And over the weekend, we talked about how amazing it is to sit at a table with women who are in love with personal growth, in love with helping other people, in love with being part of a larger community and wanting to feel normal. Like, this is okay. And being a part of all of this has been just so amazing for me. And I'm so happy that I get to do it.
Me too. And
Thank
I'm so
you.
thankful for you. Yeah, thank you so much for all that you've done for us. I really appreciate it. And you're right. Like, us three women right here, we're committed to personal growth at the same time that we're committed to helping as many people as we possibly can. Like, that is the goal. Keep ourselves inspired and inspire others.
Exactly. So, ladies, I won't take up any more of your time. We have had a full day of recording today, so I'm sure you're ready to relax. Let's take your headbands off and chill.
Headband gang.
So, I will see you guys next week. Thank you for coming on.